Pharmaceutical companies are regularly turning respected doctors into paid influencers. And I'm going to lay out the playbook that was shocking to me, even as a healthcare journalist. For the last year, I've been researching the pharmaceutical industry, and I noticed a pattern. When pharmaceutical companies get caught lying, like in the case of Purdue and OxyContin,
less than 1% of patients taking opioids actually become addicted.
The media is eager to talk about greedy doctors and dishonest sales reps who go too far.
The key to success? The less of a conscience you had, the better.
But for all of the coverage of the opioid epidemic and the tools the Sackler family used, there's little talk about the system of influence that let it happen. A system that pharmaceutical companies not only consider legal, but ethical. A system where marketing firms write medical papers for doctors who proudly put their name on it. I'm going to talk about exactly how that happens. And it starts with the recruitment process.
Sales representatives are ubiquitous in doctors' offices.
That's Sergio Sismondo, author of Ghost Managed Medicine, Big Pharma's Invisible Hands. As part of his research, he went to the actual conferences where pharma and marketing companies convene. And he was particularly interested in one topic at these conferences, an industry term called the key opinion leader. Basically, key opinion leaders are medical influencers, usually doctors. They publish studies, give talks at conferences. They might even run a department at a university hospital. Pharma companies value key opinion leaders because other doctors respect their opinion. When they talk, people tend to listen. And so pharma pays them to attend conferences and give talks to roomfuls of doctors about how great their drugs are. And pharma companies have a big hand in what they have to say.
So they provide the slides for these talks, the PowerPoint slides. Way back in the beginning of the opioid prescription craze, Purdue wanted to convince prescribers that it was relatively safe.
There's no question that our best, strongest pain medicines are the opioids, but these are the same drugs that have a reputation for causing addiction and other terrible things.
So the typical talk would have been trying to make the case that the particular opioid were less addictive or perhaps not even addictive.
In fact, the rate of addiction amongst pain patients who are treated by doctors is much less than 1%.
I'm being recruited because I'm well respected by my peers, but I'm curious what's going on in their heads. This is not your research, and so you're going to sort of risk your credibility to parrot like what we're telling you. Do you have a sense of like what's going on there?
Well, one thing is somebody's telling me I'm influential. Somebody's telling me I am a key opinion leader. That's a first step. Secondly, then they see the money and they start thinking, okay, this actually makes sense.
Between 1996 and 2001, Purdue invited over 5,000 doctors to attend their pain management conferences. The company listed over 2,500 doctors on their speaker bureau list and sponsored more than 20,000 educational events. And this is just the first step. That's because pharma companies are not allowed to promote drugs for what's called off-label use. A pharma company, for instance, can't put out an ad saying their antidepressant also treats ADHD unless it has the explicit FDA approval for that condition. But doctors are allowed to prescribe drugs off-label based on their own expertise and research. And it's not illegal for a doctor to give a talk to other doctors about an off-label use that they've studied. And maybe you've already figured out what comes next. What if a doctor is telling their colleagues about how to use a drug off-label, but a pharmaceutical company paid for it? The company Questcor allegedly paid doctors to do just this for a particular MS drug. In an interview I conducted for More Perfect Union, a whistleblower explained to me how it worked. The FDA had approved one dosage, the doctor was recommending another lesser dose. The problem, she explained, is that the patients would never get better on the lesser dose. GlaxoSmithKline paid billions of dollars for illegally marketing drugs off-label. One of those drugs was Wellbutrin, which the FDA had approved for treating major depressive disorder. But they also paid doctors to give talks to promote the drug for treating weight loss and ADHD. These doctors may not be out to become some corrupt shill for pharma, but it biases the doctor. They may have some doubts about a drug, but money can often steer that doubt in the right direction. Pharmaceutical companies know that when key opinion leaders publish articles and give talks, they drive prescriptions. But the usefulness of a doctor's reputation doesn't stop there. For a select group of opinion leaders, they get recruited into another arm of pharmaceutical marketing, ghostwriting. That is exactly what it sounds like. Pharmaceutical companies or marketing companies they've hired regularly write articles and slap the name of respected doctors on them. To explain how, I want to tell you a specific story. Between 1999 and 2003, it is estimated that pharma company Merck killed 27,785 people with their drug Vioxx.
When they introduced it in 1999, it was going to be their primary growth driver for the future.
Vioxx is an NSAID, the same class of drugs as Aleve or ibuprofen. And once it was on the market, Merck had a problem.
They were seeing in some internal testing that the drug was causing blood clots.
What Merck needed to do was make sure that enough doctors believed Vioxx was safe and effective, but their own evidence, it said the opposite. When Merck was eventually sued for the deception at the heart of Vioxx, it became clear how they did this. Ghostwriters. Merck, and companies paid by Merck, were drafting up research papers on Vioxx to cast the drug in a good light. They were then sending those articles to respected doctors who would throw their names on it. As a result of all of this, some researchers decided to investigate how pervasive ghostwriting was in the Vioxx case. And they found 96 published articles about Vioxx where Merck was involved in the paper before its publication. In one example, a paper studied how Vioxx might treat Alzheimer's. A lawsuit uncovered a draft of that paper with one author, but by the time it was actually published, it was changed to a well-known Alzheimer's researcher. And all the while, Vioxx becomes this massively successful drug. 84 million prescriptions are written, raking in over $2 billion a year. And every step of the way, Vioxx succeeded because of a well-coordinated effort by Merck to manufacture consent among the medical community.
Merck knew, understood, and had all of the data in its possession that this was more and more known to be a health risk. And yet it took them till 2004, till thousands of people suffered heart attacks and strokes for them to pull it off the market. And that is wrong.
Sergio Sismondo, he actually went to a medical ghostwriting conference where professionals shared strategies in dealing with one of their biggest problems.
By and large, their problem is to get the authors to make some contribution at all. So they might say to an author, thanks very much for looking this over. Now we have this task here. Could you please take a red pen to this methodology section and see how you can cut this. So they have to direct the authors to make some sort of contribution.
When a new class of antidepressants went on the market, pharma companies selling SSRIs promoted the chemical imbalance theory of depression by forging relationships with psychiatrists who wrote textbooks, articles, and even clinical guidelines. They even sponsored awareness campaigns, which probably worked, because if you asked most people what causes depression, they'll probably spout off this theory. Except there was never really much evidence that this caused depression. The proper use of antidepressants in children is hotly debated among psychiatrists, and listen, as a non-doctor, I really have no opinion. But some pharmaceutical companies do have an opinion, because opening up the antidepressant market to children would earn them billions of dollars. Let's take the example of Lexapro and Celexa. They're made by Forest Labs. Forest Labs entered the debate by ghostwriting articles encouraging the prescription of those drugs in kids. And the research manuscripts were written by an agency they hired, Weber Shandwick Communications. Forest employees had the power to sign off on the manuscript, though none of them were actually listed as authors. Eventually, the lead author was a prominent child psychiatrist, Karen Wagner. When researchers investigated, they could find no evidence that Dr. Wagner contributed to the study design, analysis of data, or preparation of the first draft. One ghostwriter I spoke to stressed that the people writing these articles believed in good science and that they were encouraged to critique everything. They described firewalls between the marketing departments and the people who write these kinds of articles. But in the Forest case, and certainly others, that firewall failed. One ghostwriter describes the process like this. I agreed to do 2 reviews for a supplement to appear under the names of respected authors. I was given an outline, references, and a list of drug company approved phrases. I was asked to sign an agreement stating that I would not disclose anything about the project. I was pressured to rework my drafts to position the product more favorably. So when I spoke to people involved in medical ghostwriting, I wanted to know what's changed since these big scandals. The answer I got was not much. What's more troubling, medical journals know about this. They even encourage it.
When I attended these ghostwriting conferences, some of the speakers would be journal editors, and they are speaking in part to pitch their journals.
For academic journals, there's a clear conflict of interest. If they're constantly rejecting articles from pharmaceutical companies buying millions in reprints, it's bad for business.
It is reported that one of the key articles on Vioxx had something in the order of 850,000 reprints. So $1 million worth of revenue went to the New England Journal of Medicine.
There is a hard problem to solve here. Pharmaceutical companies develop and test drugs they want to put on the market. A ton of them are life-saving, or maybe just life-changing. But time and time again, they throw their money around to distort scientific progress, not supplement it. In the case of Alzheimer's, there's currently debate raging about how to diagnose the disease. One method is to detect what are called amyloid plaques. Again, I am not a doctor. But as some doctors do argue, not everyone with the plaques develops the disease, so maybe it's not the best measure? Nevertheless, companies like Eli Lilly are pushing for a diagnostic blood test that can detect amyloid plaque in the brain. Now, why, you might ask? Because they manufacture the drug that targets the plaques. But many doctors don't take pharma money, let alone ghostwrite articles. And for all the rest, there's something called continuing medical education, or CMEs. That's this last part of the pharma playbook I want to discuss. Doctors across the US are required to take classes or attend lectures so that they can stay on top of the latest medical advancements. But who pays for these kinds of things? Often, it's pharmaceutical companies.
This is the Network for Continuing Medical Education, supported by Roche Laboratories.
So the company will give the firm a grant to produce a continuing medical education course on a particular topic, and then be lightly involved in the design of that course.
Imagine this. You're a psychiatrist trying to learn about the latest development in depression drugs. But what you get is a message paid for by a pharmaceutical company who sees your education as a marketing lever. CMEs have been implicated in many of the scandals we mentioned, including the off-label promotion of Wellbutrin.
The agency that is producing that course knows full well that they will never get another grant if they don't produce a course that meets the needs of the company.
And here's the problem. These forces are so widely used, it touches on drugs that are good and drugs that are bad. Even as a journalist, I'm having kind of a crisis. I only ever hear about the worst of the worst. Drugs that work well that get ghost write-ups under the name of a key opinion leader, that doesn't make the news. At the same time, we have documented cases where corporate shenanigans have killed hundreds of thousands of people. Some people turn to alternative medicine, which features its own cast of villains looking to make a buck. Supplement sellers don't need to pay off doctors to write studies because they're barely regulated. You've probably seen the results. There's a rise in pseudoscience as an alternative to the financially conflicted science. And again, it's not just the opioid epidemic. Johnson & Johnson and other companies used it to illegally sell antipsychotic drugs to the elderly. It often takes us years or even decades for the full cost of these schemes to come to light. They happen after countless hours of work by journalists or attorneys to uncover the truth. Listen, I can't tell you what drug will be the next Vioxx or OxyContin, but I can tell you not much has changed to stop this from happening again.